Yeah. We say in hypnosis that the biggest thing on that, which is important to have the mind in the right place, is that we say that the mind or the unconscious doesn't know the difference between imagined and real. They're
It
both
doesn't. No,
so they're both
no.
the same. So I say now at the most basic level, the idea of hypnotherapy is to get you to imagine stuff differently.
Welcome to the Everyday Epigenetics Raw, Real, Relatable podcast. I'm your host, Susan Robbins, epigenetic human performance coach. This is where we discuss all things lifestyle, environment, food, exercise, work, mind, and social interaction as they pertain to epigenetic expression in a way that's relatable to everyone. So if you're ready to start viewing you as an individual, take control of your life and health, and get results, buckle up, here we go. Welcome to the Everyday Epigenetics Raw, Real, Relatable podcast. I'm your host, Susan Robbins, and this is a place where we talk about everything lifestyle and environment and how it relates to our genetic expression. Today, I've got a super interesting one that I'm really excited to hear about because it's something that I'd never heard about. And when I came across my guest on the podcast page that I have with different podcasters looking to find guests or be guests, I poached him off of someone else's post. I saw what he did. I'm like, you need to come on my show. I would love to talk to you. And he's from across the pond over in Great Britain. And we are going to be talking about, I've had someone on here talking about hypnotherapy as it related to stress. This is going to be very different. This is clinical medical hypnotherapy expert that I have on. And we're going to be touching base on something called hypno-oncology and psychoneuroimmunology. And don't let those terms scare you off from this podcast. All my layman people, don't run, non-science people, because I'm the scared of the overdoing the science because I won't take it all in. And if I can get this, you can get this. So stay with us because this is going to be super interesting and he's going to make it very relatable so you understand it. And I think you're going to jam on this. So please stick around here. My guest's name is Garry Coles. Garry has over 20 years experience as a full-time hypnotherapist. He has a master's in science and clinical hypnotherapy, for which he carried out research into the effects of pre-surgical hypnosis. Again, something I never would have thought of, on the recovery quality in breast cancer surgeries. He was contracted for over 19 years to a major UK hospital for oncology-based hypnotherapeutic work, in addition to practicing from within a local GP surgery. Garry's a regular presenter worldwide, and he just told me his schedule for the upcoming several months, and I'm already tired listening. And he's at conferences as well as presenting his own popular master classes and monthly mentoring services. And that's for practitioners, I believe,
It is, yeah.
to work with that. Yeah.
I don't work with. I work with people that are still training, but I don't teach basic hypnotherapy as such. I teach oncology based stuff, advanced techniques.
Yeah.
The mentoring is more general, so that's for everybody, but it is really for qualified hypnotherapists.
Well, welcome to the show.
I work with the general public, obviously, for things like oncology,
Yes.
and I work as a general hypnotherapist as well. But this is what I'm known for, is the oncology sort of area.
And this is your passion, right? The oncology area. So
this is what I specialize in.
I'm really excited to have you here. So thank you for taking the time out of your incredibly busy schedule and taking the time to come and talk about this. Let's just jump into it. What's your story, Garry? Why hypno-oncology out of all the different things, like you said, the general things with hypnotherapy?
It's a lot of things in my life to do with hypnotherapy, I think, have happened quite by accident more than anything else. Although I guess there's some things in the background that may psychologically lead you into certain areas. My grandfather lived with me for a number of years, and he lived into his 90s, but cancer got him. My mother actually died in her 50s from cancer, and I went through the whole journey.
Oh, wow.
So whether something like that was in the back of my mind, I don't know.
Yeah.
We got into. I was in industry. I was actually an IT consultant in the oil industry originally.
You're kidding.
No, I studied maths and computer science originally, and and I was an IT consultant in the oil industry. Due to consolidation in the industry, that ended, and I had no idea of what I wanted to do. Other than that, I decided I wanted to work for myself, and that was it. And I thought, I know nothing apart from IT. And, so I was in a fortunate position that I didn't have to work for a couple of years because of of circumstances. So I set up a bookstore, a web shop selling books for Christmas. And Christmas came and went, and I thought, "What do I sell in January?" And out of the blue, somebody offered me a job lot of hypnosis CDs, and and they were selling one. I thought, I didn't realise it was quite as popular. And I must admit, I came from the background being very scientific, that I thought, I'm not even sure I believe in this. It's I said,
Mhm.
I'm not convinced." And, but I thought, a lot of people obviously do because that's selling well. And I thought, "Okay, I'll do a bit more investigation." And it just so happened there was a local psychologist, doctor of psychology, doing an introductory hypnotherapy course. And I thought, "Oh, I'll go along and have a look." I'm still skeptical, but I'll have a look. And so I went along, and one of the things that he said, I will work on an issue with everybody." And he said, "What would you like me to work on?" And I said, "Well, actually, I don't feel I've got any issue. I'm quite happy with stuff." And he said, "There must be something." And I never thought of it as an issue, but I always used to suffer from nightmares. Since as a kid up until adulthood, 3 or 4 nights a week, I would wake up either shouting, screaming, punching,
Wow.
and then I'd just turn over and go back to sleep because it was normal. It just it was just how
Yeah.
it. And I mentioned that to him, and he said, "Oh, we'll work on that for an entire afternoon." And he explained to me all the things that were gonna happen in the session, all the things I'd see, all the things I would do, and so on. And none of it happened. And so I was even more skeptical. None of it happened whatsoever, and at the end of the session, he said, "What do you think?" And I said, "I was keeping my eyes shut out of respect for who you are and what you're doing, but," I said, "I don't think I was hypnotized. Nothing happened. Everything you said I would see or do didn't." So I said, "So I'm even more skeptical now. I just don't believe in it." And he said, "Okay, see how you go." And I was sitting at home about 4 or 5 weeks later, and it suddenly dawned on me I hadn't had a nightmare since then. And
Wow.
I thought, "There's more to this than meets the eye." So I thought,
Yeah.
I wanna get into this." So I thought, "Okay, I'll do a basic sort of diploma in hypnotherapy," which I did. And so I started practicing. I thought, "Well, actually, let's see whether I can make a living out of this." So I started practicing, and then out the blue, I had a phone call from a hospital saying, "Oh, we used to have a hypnotherapist here, and it works really well with cancer patients. Would you like to come and give us some time and help us out for a while?" And I thought, "Well, yeah, I need experience." I thought, "I'll just go in for a few weeks. I'll see a load of I'll see 8 patients a day." So my experience went through the roof, and I thought, "I'll disappear. I'll go in there and then disappear after a couple of weeks." And then I ended up being there for 19 years in the end, so that didn't quite work as planned.
Oh my gosh.
And then it went from there because I started working with a lot of cancer patients. I knew what worked and what didn't. I was developing my own techniques. And then I got the opportunity that one of the universities started up a research masters in clinical hypnosis. And I thought, great. Again, because I come from the scientific computing background, maths and computing, I thought, yeah, I'm a bit of a geek. I'll do research masters, and and it was the first cohort in the UK. I think there's only about 18 of us now. There's not many at all, and then they said, "Oh, what would you like to do some research in?" And I thought the only area that I really know a lot about is working with cancer patients. I thought, let's do medical hypnosis, and that caused me lots of ethics problems because you saw the look on their faces. Everybody else was doing quit smoking and weight loss, and I said, "I wanna do
Mhm.
research for cancer patients," and you could see the colour draw out of them and go white, going, "Ooh, you can't do that,
What
oh."
what do you think is what was the hesitancy or the fear of that?
I think even the university, because it was the first time they'd run a master's degree in clinical hypnosis, that I think they didn't really understand what it was all about. And because we have such a sort of with the NHS in the UK, we have such a big thing on ethics that you can't do this, that, and the other. And we actually have a 1939 Cancer Act that rather restricts you from all sorts of things. So they were a little bit panicky about it. So I had to go through ethics with the university. It got rejected once, and then it got approved the second time. Then I had NHS ethics, and then I had hospital research and development ethics, and I had to go through all these things. But I thought it's something I'm passionate about, something I know about, and something that's going to be useful.
Yeah.
So that's when I did my research on on what I did was looked at pre-surgical hypnosis and the effects that had on recovery quality in breast cancer operations. And it does improve the recovery quality, to the extent now, and it wasn't down. I would own up and say it wasn't down purely to my research, but the Royal College of Anaesthetists in the UK now actually recommend pre-surgical hypnosis. They don't call it that. They gloss it up a little bit so they don't frighten people, but
Mhm.
that's essentially what it is, and they now recommend it for surgery.
So what tell me, what does that involve and how does it help?
Or the study I did, because I had to do a scientific study, obviously I had to have lots of criteria. So I
Mhm.
was looking initially, I wanted to look at the psychological aspects of surgery because people associate things like hypnotherapy with working psychologically with people. So I thought I'll look at the psychological aspects. I did a gold standard psychological questionnaire with people just before they had their pre-meds for surgery. And that was looking at all sort of quality of them psychologically. And essentially, when you put it through the computerization, everybody that was just about to undergo surgery were essentially depressed. And let's say
Okay.
that's not a surprise. Yeah,
Yeah, yeah.
there was fearful depression and so on. Then what we did is we had a group where we had just a session of hypnosis before they went to pre-med, and that was to get them to be compliant when they were under anesthetic, to have a good journey under anesthetic, and to have a good healing quality and to be relaxed and all sorts of other things in it. And 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 then we followed up with the same questionnaire a week after surgery. Now, it was a week after surgery because at that stage they hadn't got any results, so everybody was still in the same ballpark. If they'd have got results and some were very positive, some were bad, then, that's gonna skew things, so it had to be before people
Yeah.
got results. And we found that the group that just did the questionnaire, i.e. the control group, they were exactly the same. They were still depressive, etcetera, etcetera. The group that had the hypnotherapy were back with what we would call population norm. So if you like, normal, not no longer.
Yeah, yeah.
But what was interesting, we also did some physical, checks as well, and also got them to talk to us about things. And one of the interesting things, we did pain perception, we looked at, and we found that the group that had the hypnotherapy, a week after the surgery, they perceived that they were feeling far less pain than the other group. And when we delved down a little bit more, we found not only were they perceiving that they were feeling less pain, they were actually taking far less pain medication than the other group. So therefore,
Wow.
it seemed to indicate that hypnosis made the drugs more effective, but because of the perception of it. So
Wow. It's kinda like is it like a reverse placebo, right? That you're
you could,
kind of
yeah, you
putting
could
in
argue
there
that, yeah,
that
yeah, yeah,
I don't need it as much. It's actually
yeah,
working, not needing this.
yeah, and we
This
do
is
find that they get fitter quicker, that it frees up bed space quicker. So there's all sorts of benefits to it.
Was there any follow-up? Now, did you only see them with the pre-op stuff, or did you also do follow-ups later with them throughout
No,
treatments?
it was just purely the week after. For a number of reasons, that the amount of problems you have to go through for ethics in this country is phenomenal. And also because I was doing it for my master's degree, I was very, very limited on
Mm,
brain and
yeah.
so on. So, there was lots I would have liked to have done. I'd like to have compared live hypnotherapy with recorded audio hypnotherapy to see the difference. I'd like to have compared one and a number of sessions. I'd also like to have done post-surgical stuff because I do that, and I believe that
Mhm.
makes a difference as well.
Yeah, that's what I was wondering.
Time and money was the biggest problems.
Yeah. I just find it incredible that there's so much pushback on these things that are non-invasive, right?
Yeah,
No
absolutely.
drugs, nothing, but yet the mind and the body can do so much healing itself. But there's the pushback on that is that being not potentially unethical. It's like
Oh, yeah, yeah. I mean, there was all sorts of crazy things from the ethics over here. One of the things that I remember that made me laugh was that, when I finally got through to the research and development ethics at the hospital, they panicked a little bit, and they put lots of rules in place about how things had to be reported and how often, and people that you couldn't advertise to people or cajole them, and they had the rights to pull out at any time and not do things. They were very protective. And then the final
Mhm.
thing they come up with, they said, "Oh, and everybody involved in the project's gotta have a good clinical practice certificate. You've gotta be qualified as a good clinical practitioner." So I went to the hospital. I said, "Look, how do I get qualified as a good clinical practitioner?" And they said, "Oh, you have to go on a course, but as you're here doing the work, we'll pay for you to go on the course." And they said, "Everybody involved in your project's gotta have a good clinical practice certificate." And, anyway, so I got it. I did the course, and I got the good clinical practice certificate, and I found out I was the only one that had one. All the doctors, all the nurses, and all the hospital staff, they'd all run out a couple of years ago and hadn't had time to resit the tests and the courses. So I was the only person that actually had this thing, which again was
Wow.
crazy. They make you jump through
Oh my
hoops.
god.
Nobody else has actually done it, and they're actually working full time with patients.
Wow. So you did this research, and then did that take you into working specifically with cancer patients? And was it just breast cancer, or have you worked with all different types of
I work with
cancers?
I work with all cancers. The reason that we did breast cancer for the research, again, was time factor. The hospital that I was based in, the biggest throughput was breast cancer. So as that was the biggest throughput, that meant we were more likely to get a number of participants into the trials.
Yeah.
So that's why I went there. I work with people with all types of cancers. I spent I probably worked with about 2,500 or so cancer patients over the years. And really, although I'm a full-time general hypnotherapist, I did a day or a day and a half a week in hospital. So and because I then did the research and have got the background from hospital, that started getting me known. So once the research
Mhm.
came out, I started getting people emailing me saying, "Oh, you're a bit of an expert on working with cancer patients. Can you give me some advice?" So I do that, and then I was asked to do a couple of podcasts. I was asked to more advice, and then a couple of people said, "Oh, you ought to put a training course together." And I thought nobody's going to be interested in that. And then it was probably about 10 years ago. I was asked to speak at a UK convention, and I've been invited to speak every year since. And then, based on the back of that, I was invited to go and speak at the biggest hypnosis convention in Las Vegas, and I'll be speaking for the eighth time there this year, the eighth year running there. And it just escalated from there. So then I put a course together, and I thought, I can't see anybody interested, but I'll put a course together, and I wrote a book for the hypnotherapists as well. I'm now doing one for doctors. And yeah, so I did a couple of courses in the UK, and then I got asked whether I'd do it in the US, and it took off from there. I was then invited to go and teach doctors in Belgium. I then did psychologists in Bahrain, and it's just gone from there really. So it's been
Wow.
led by it rather than me, I would say.
Yeah, that's amazing. What kind of when you're working with the cancer patients, and when you do or you teach people to, is this um surgical only, pre and post-op only, or
No,
is
the
it
entire journey.
just the that's what I
Yep.
wondered.
Yeah. I say when I'm doing sort of my formal talk, if you like, I say hypno-oncology, hypnotic interventions for the cancer journey. That would be
Okay.
the title, but it's a bit of a
Yeah.
up on the background behind me.
And so it definitely it makes a difference then as far as how they respond to treatments or not, because aren't there some that don't want to do the general treatment, the chemo, radiation, and choose to try to do a more natural way? And we know that the mind plays a major part with that. So
Yeah.
do you also work with people that don't do the traditional cancer treatments?
Yes, but we have to be very, very careful in the UK. We have a 1939 Cancer Act, and under the 1939 Cancer Act, unless you're a doctor, oncologist, surgeon, etc., you're not allowed to treat people with cancer. You're not allowed to give advice on cancer, to remedy, or anything else to do with cancer. Now, obviously, I can work with people with cancer because I'm not treating the cancer, technically.
Yeah.
There are people that with the mind-body link want you to work with them with the cancer. So I do that, but with the proviso that it's for their psychological well-being only, because there is no scientific underpinning for what we're actually doing. So I have to do it that way because otherwise I get prosecuted. But you do have to be a little bit careful, because there is also another thing that, particularly in early stage cancers, if you actually advise people to go down totally the complementary therapy route, and shun all mainstream treatments, generally the death rate is around 6 times higher. So it does have a negative impact.
Oh, wow. By just suggesting that.
But no, people that go down that route,
That go down that route alone.
complementary, early stage cancers, if they go purely down the complementary route, the death rate is generally six times higher than those that going down the traditional route.
And is that for any specific type of cancer or
Just
all
generally, just overall.
general, in
Yeah,
general?
general overall. Yeah, and there is also, unfortunately, a lot of people that misunderstand stuff. There's some research done in the US. Trying to think, it was one of the oncology organisations that they did the research with. They interviewed several thousand people, and a big percentage of those either had cancer or had cancer, and a big percentage of them believe that you could cure cancer with diet and herbs alone, and oxygen treatment and all sorts of other things. So there's a huge amount of misconceptions on what you can treat it with.
Mhm.
And also people will jump at the chance of anything because a cancer patient is desperate. So they will
Yeah.
go for anything and throw money at anything. And there's all sorts of rubbish that I hear that, "Oh, you can do this and you can do that," which isn't true generally, but because they'll believe that if somebody says, "Oh, yeah, you take this or take that, do that," they'll throw money at it and do it because they believe it and they're desperate.
Mhm.
But yeah, so essentially I work for the entire journey. So give you an idea of what we would do for the journey, and it's from beginning to end. So initially I would deal with the psychological fallout. People have been diagnosed, so there's fear, panic, worry, and so on.
Yeah, that's a death sentence right off the bat.
Yeah.
Yeah, that's the
Yeah,
total fear
and
that comes up.
then we'd move on to perhaps fears and phobias. There might be people that are frightened of scanners and needles and stuff like that, going to the hospital, surgery, all that sort of thing. So we'll deal with the fears and phobias. Then the area of my research, pre and post-surgical work. The area that I actually do most work in, surprisingly, is actually working with the side effects of treatment. Things like anticipatory nausea, taste changes, tiredness, sleep issues, all
Yeah.
that
Yeah.
stuff. That's probably the biggest area. Then I deal a lot with hypnotic pain control because the hypnosis is by far the largest studied complementary therapy for pain control, and it's very effective for it. Um,
Wow.
then then I will work with palliative care if that's required with people, and then also post cancer, if you like, because sometimes people go on and they're cured, but it's a bit of a wake up call for their life. Oh, I need to change this, or I need to change
Very changing. Yeah,
that.
they're changing the lifestyle.
Yeah. So really, I would work from beginning to end. The end is either total cure and change in lifestyle, or sadly, death, which is where the
Yeah.
palliative care comes in. But yeah, so that's why I call it hypnotic interventions for the cancer journey, because it's the whole process.
I love that. Yeah, you're embracing the person from beginning to through their
Yeah,
journey, not just that one little right before the surgery and done. I like
no,
the one
no,
and done
no,
kind of thing.
if
It's
they want me, the whole
literally
journey.
a whole journey. You're like their co-pilot or
Yeah,
the pilot helping them
yeah, that's
to
it.
drive their own boat. What's the longest period of time that you've worked with somebody?
I've had people that generally, a lot of people, that some people you only see them once or twice. I do a lot of what we call emergency interventions. You might have somebody that's been diagnosed, so they're now having a full-blown panic attack, so you just need to go in and stabilize them. A lot of patients, probably the most common, I would only see patients really when they're going through the chemotherapy journey or their radiotherapy journey because I'm dealing with the side effects. Others, probably you would perhaps see them at the pre-surgical stage, and then you would do a little bit of the post-treatment afterwards. And some you do follow up even years later. I've seen some people for certain things. I've got a lovely story, which a good story of hope, if you like, in this way.
Bring it. Hope
Yeah,
is yeah, we'll take the hope all day
absolutely
long.
brilliant. It was a patient that I saw, and the first time I saw her was actually on the ward of the hospital. She hadn't seen me prior, and it was a lady. She was in her late 20s, had a very active lifestyle. She was into parachuting and doing all sorts of things
Oh
like
my
that.
god.
She was told that she had colon cancer, and she was told that they didn't think it was very bad. She'd have keyhole surgery, and that would be fine. Anyway, they opened her up and found that it had spread significantly and hadn't appeared on the scans, so they needed to remove her entire colon, give her a colostomy. Now, to remove everything, they had to break all her ribs on one side to actually get at everything.
Ugh.
So cleared everything out, give her a colostomy and whatever. So of course she comes round and she's in severe pain, severe shock. Because it had moved around a lot, that they decided she had to have very heavy duty chemotherapy as an add-on. Her body reacted badly to that, and she actually died twice and had to be resuscitated.
Oh
Uh,
my god.
and that was the time I first saw her after she'd been resuscitated for the second,
Wow.
because she was in so much pain, so much shock, I couldn't sleep, all sorts of other things. So I went in to see her on the ward, and we worked on the pain, we worked on the shock, we worked on sleep issues. So I worked with her for a few weeks actually on the hospital ward. Then she got well enough to leave, so she was coming back seeing me regularly as an outpatient. And again, we were working all those sort of things and life changes and getting over stuff. And then I didn't see her for probably about 5 or 6 years. And the last time I saw her, she came to me privately as a private patient for sports performance. She wanted me to help her improve her triathlon performances.
Oh my god. I wouldn't wanna do that without having cancer.
Yeah,
Wow. Wow. And did you improve her performance?
yeah. Yeah, I do a lot of sports performances. I mean, that's the other side. I'm known for cancer, but I work with sports performance with Olympians and world champions and all sorts of people.
Oh my gosh, I love this. Okay, now you're really like that's barking up my that's barking
Yeah.
up my door there. Um, so I want to touch on because this kind of leads into this because you've talked a lot about the feelings and emotions these people are having, depression, fear, and those are paralyzing, right? They're
Mhm, yeah, they are.
paralyzing. They paralyze the body. We talk about turning genes on and off, and so let's go into this again. People don't run off when you hear this word, the psychoneuroimmunology, because I
Correct,
asked
yeah,
Garry about this before we talked, and he said I can put this in a much simpler way to understand. So
yeah,
I'm going to let you run with this because I think this is fascinating.
yeah. First of all, psychoneuroimmunology is a bit of a mouthful, so we call it PNI for short. It's much quicker. And actually what PNI itself is it's the scientific study of how feelings and emotions affect the immune system and impact the immune system. And a very basic level is that we know that somebody who's, say, incredibly depressed and very down quite often can catch a cold or catch
Yep.
some ailment, because what has happened, because they're depressed, their immune system is compromised, so it's not working as well as it should. So where PNI comes into this, or the study, or where hypnosis comes into this, is that if we take this full circle, and I'll give an example. So I said I was going to give an example. Another area I do a lot of work with, we're going all over the place here, is unexplained infertility. Women that are struggling to become pregnant or having IVF and things like that.
And with no biological, like with no biological
Yeah,
reason.
with no necessary, with of unknown origin, if you like,
Yeah. Okay.
unexplained infertility.
Yeah.
Now, somebody who's undergoing or having unexplained infertility, generally they start to get stressed and anxious about it. If they're stressed and anxious, that decreases estrogen production. So they've got less chance of falling pregnant. So if you like, they're sabotaging the body
Yeah.
psychologically,
Just within the
but
mind.
they're doing something physically to the body.
Yeah.
If they then go into depression, that actually releases prolactin. And that is another chemical that actually is released during breastfeeding, lactation,
Hmm.
and it designed to
Nurturing. Yeah.
stop them becoming pregnant because they're breastfeeding. Now, these
Yeah.
things are happening. They're physical things that are happening. The estrogen stopping, prolactin increasing, and they're being caused or happening due to psychological reasons: stress, anxiety, and depression.
Hmm.
Now, with talking therapies, such as hypnosis, we can deal with feelings and emotions. So if we can deal with the anxiety, we can deal with the depression, we can actually rebalance the hormonal system. And so
You're
that's
kidding.
no, that's at the very basic. Now, if you could say we can take that one stage further, if we can say that we know the psychological means if you like, drop the immune system and cause these physical things within it to happen. We know that talking therapies can stabilize it, but then surely, if it works the other way round, surely we could be able to increase things like that, like estrogen
Mhm.
production and so on.
Mhm.
And the answer scientifically does appear to be yes. My own experience, for example, with unexplained infertility and IVF patients that I've worked with, over 50% of the people I've worked with have become pregnant and gone on to have children.
Oh my gosh.
Yeah. So, again, there's some good arguments there. So that's how I always explain PNI, except with
Yeah.
PNI, we go on to the next stage that, there is evidence that feelings and emotions can affect the immune system, and things like hypnosis can affect the feelings and emotions, and therefore can actually change the immune system. And there's some very interesting scientific research, and that this is not being made up stuff. These are in scientific journals. But there's evidence, for example, that self hypnosis and hypnosis can keep hay fever symptoms at bay. There was a very good one that we touched on before when we were talking before. HPV, genital virus,
Mind blowing.
a transmitted disease causing a genital infection, and that can actually lead on to things like cancer, cervical cancer.
Yeah,
It's
cervical cancer.
1996 research, and that compared lone hypnosis treatments with medical therapy, and both approaches showed patient improvement, although after the 3 months stage, total clearance rates were overly in favor of hypnotherapy only, in the region of about 5 to 1. So,
With HPV,
yeah,
and that's your genital warts, basically.
yeah,
And hypnotherapy
yeah. It
was
was
shown
shown in
in
that
this
time to
study to be
yeah,
better.
it's 5 times more effective, yeah, at a 3-month stage.
This is
Uh,
how powerful our minds are. There's a meditation I like to listen to in the morning every once in a while. I do actually quite often. It's a gratitude meditation. And he talks about a guy, and I haven't read the book, but the guy's name is Will Pye. And he said he basically healed a brain tumor
yeah,
through like gratitude practice. And it's it's just things like that. People say these are miracles, but I think our bodies and our minds working together can be miracles
yeah,
that
yeah,
really play to us or against us.
yeah, I mean, we don't know. Again, obviously, because I mentioned it, in the UK, we have the 1939 Cancer Act, so we have to be very careful about what we can say
Yeah.
and do. But we do know that, particularly with the cancer rate, there are lots of spontaneous remissions. We don't know why that happens, how that happens. Are they miracles? Are they something to do with diet? Are they something to do with mind over matter? Who
Yeah.
knows? But and certainly I am not allowed in the UK to treat cancer with things like that. But I have people
Yeah.
come to me saying, I would like you to give me guided visualization for me working with the cancer, destroying it, treating it, doing all sorts of things with it. And I do that for them, but it has to be on the proviso that the only reason we're doing it is for their psychological well-being, because we're not allowed
Yeah.
to treat the cancer. And
Yeah.
there's lots of people that swear that that's the way to go, and it does help and it does improve things. But obviously, we can't claim anything as such.
No, no. I have
Um,
to always do my disclaimer of people, I am not a practitioner. I don't diagnose, treat, or cure any illness or disease. Genetics isn't meant to diagnose, treat, or cure any illness or disease. It's to help you make better choices. And I say, not that it hasn't happened, but
yeah,
I
yeah,
can't claim that I do or I'm gonna be shut down. So that's just how it works.
yeah.
Uh,
And,
a
and
couple
another piece of research actually on there, and another one was we talk about hay fever, and it was looking at hay fever symptoms. This was a randomized control study, and it was shown that hypnosis outperformed allergy therapies and was shown to be as effective as hay fever medication when dealing with the symptoms. And then by teaching self hypnosis, it offered the same responses a couple of years in the future.
now that's hay fever. Say you have somebody that's got a lot of histamine issues or food allergies. Has there been anything with hypnotherapy to assist with that?
Yeah, they do work on those sort of things as well. I haven't got any piece of research in front of me that I
Yeah.
can quote you, but yeah, there's a lot more research into the use of hypnosis than people think on areas that people think. Another
Yeah.
area, which I haven't got research with me, but there's a load here in is that we actually is now recommended by the NHS in the UK, is one of the few things that even the NHS recommend hypnosis for. But there's a lot of research into irritable bowel syndrome, IBS, and uh, and in the UK there is now a hypnosis unit set up in a hospital purely to treat that because there's so much evidence behind the success, and even the NHS
It's such
recommend it.
there's so much with IBS that's stress driven.
Yeah, it is. And the other area that it's actually stress driven as well that there's a lot of research in is sort of skin problems.
Oh,
That's
yeah.
eczema and stuff like that.
Oh, yeah.
So another very
Stress
big area.
kills.
Yeah.
That's what I say, stress kills, and I wanna ask you about sleep because something that I've been dealing with, and people have been listening to me here and listening in succession for months. I've talked about this chronic back thing I have going on, and for about 3.5 months, the pain kept me awake because I'm like, I'm not gonna take painkillers, and so it will wake me up, and then I just couldn't get back to sleep. I'd be up for 3 hours, sometimes 4 hours in the middle of the night, like, no quality sleep. I get labs back and I look at how that stress affected, and I'm somebody that my lifestyle, look what I do for a living. I'm dialed in, right? Sleep is so important. This is where we heal. This is all of it. And my labs were so off with glucose, with lipids, hormones, even my testosterone, everything just completely affected by this lack of quality sleep. And now I'm at the point I'm not being woken up by the pain now. That's really leveled out. But I
Mm,
think it's in my head that, am I gonna wake up? And I had 3 or 4 nights in a row last week that was every 1 to 2 hours I was awake.
mhm.
So, but, like, by day 5, I'm zombie girl, and like your cancer patient, super active. I'm all about performance. That's why when you say I do for athletic performance, like, "Ooh, I have to talk." But what about somebody that has almost an anxiety about sleep? That what if I wake up and I'm not gonna be able to get back to sleep again? That's like the fear. Can
Yeah,
hypnosis help
we call
with
that,
things like
yeah, we
that?
call that a self-fulfilling prophecy. But
Jesus. That's
because that's what happens. You basically you pre-program yourself not to do that because so I always say was it catastrophizing or a self-fulfilling prophecy? Is that
yeah,
you think
yeah,
that something will happen, so the unconscious thinks, "Okay, that's what they want to happen, so I'll make sure that does." Because
yeah,
it's, well, yeah, they don't want to go back to sleep. That's why they're worrying so much about it. So,
true. And that sleep is such, as you're talking about the PNI, sleep is a major part of the immune system.
yeah.
And when we don't sleep, it
Yeah, and one of the things
things crash.
actually
Stress
on
kills.
that, we are talking about the stress thing, and
Yes.
as we said, we wanna keep it as non-scientific as possible. But there are things in the immune system. There's something called cytokines in the immune
Yeah.
system, and
Inflammatory cytokines.
yeah, and there are certain ones that are actually known as the things called interleukins, IL-6 and things.
IL-6,
Yeah,
you're
uh,
speaking my language now.
Yeah,
I've talked about
and
them for
again,
years, so you're good.
they're pro-inflammation. So things
Yes.
like stress will cause inflammation, which obviously in turn causes pain, causes stress on other parts of the body, and causes things like not sleeping.
Yeah, and that lack of sleep. I laugh if you saw my desk here, I have the addition here. There's Post-its all over the place because I do so many different genetic things. I
Yeah,
have things in my head every once in a while, you're like, "Where did that go? Like, why can't I think of this?" So I have my Post-its to back me up just in case I, like, have that moment of, "Wait a minute." But as I did some research on IL-6, one of the things, chronic stress, and this is pro-inflammatory cytokines as you're talking about, chronic stress, poor sleep. The 2 right there, and then when you've got poor sleep, you're leading to more stress because you're not
absolutely.
sleeping, and then the body's not recovering, and people don't even realize that, or then, you'll have the, "I'm just gonna have my glass of wine to take the edge off." Okay, alcohol is gonna increase
Yeah,
the IL-6, and then what was the other one? The sugar, that's a given, but exercising 2 hours plus daily. So you have your real endurance people out there, it's released positively during exercise, but when it's excessive, people a lot of people don't realize that they're increasing that inflammation with excessive exercise
Yeah.
too. So it's that little fine tooth comb there. So before we close, I have just another question here.
Mm.
Does the guided, like going through sessions with you, is that where you would recommend someone start? Is that better than, like you said, the self ones where you can get things from online if, through you? Is one better than the other, or does it really depend on the individual?
Certainly live is far better because a lot of people don't realize when you're doing hypnotherapy, for example, there is a lot of little subtle things that we look for to do with people swallowing, the breathing, the eye movement, so that we know exactly the state that you're in. So we know when to deliver things to you and so on, which obviously you're not getting that from an audio. And also a couple of other things that I do is one, if I'm working with somebody, we'll personalize it to them, which is very important to their unconscious mind. But also, and again, I don't know what you've had in your other sort of talks on hypnotherapy, but I do a lot of analytical hypnotherapy where essentially we ask the unconscious why you've got a problem, and it tells.
Mhm.
And
Mhm.
look for things like, was there an event that caused the problem in the first place? In which case we look at that to reframe it. And an area I do a lot of work with is what we call parts work. Which part or parts of your unconscious believe that the way you feel or act in relation to your problem is useful, normal, or desirable in some way. And there will be parts of you that think that it's useful, normal, or desirable, otherwise you wouldn't feel or act that way. And the idea
Right.
then
Right.
challenge those parts. And you can't do any of that with an audio. All you can do with an audio is basically hypnotic suggestion, what we call post-hypnotic suggestion. And even
Okay.
that, I would normally personalize something to somebody. If they want it as an audio to back up, then fine, but I would normally work with somebody. We would put something suggestion together purely for them on what they wanted to achieve in a way, a language that resonates with them, and then we would
Mhm.
session and then give it to them as an audio to continue working with.
And what about video? Because I know you can also work with people via video as well as in
For Zoom,
person.
yeah, I've got clients that
Yeah,
go.
and that's as effective?
Absolutely, yeah. Some of the techniques you have to change slightly because some of the techniques that I quite like doing are what we call very kinesthetic, touchy-feely. I might pick up somebody's hand and shake it around and drop it in their lap.
Mhm.
Obviously, I can't do that over Zoom and things like
Right.
that, or tap them on the forehead or things like that. But there are ways of doing it, and yeah, I with cancer patients, I've got cancer patients in the US, in Africa, and Australia and New Zealand, and other people. I'm working with somebody in Morocco, a business person at the moment. I've got somebody else for addictions in Croatia. And so, yeah, so I work with people all over the world, and it's not a problem at all.
I just love that by just working with our minds and our subconscious that we have so much control, and it's not always about the invasive treatments or the medications, and it's such, even if you're doing those things, to have your mind in a good state
Mm,
is really it's a game change.
yeah. We say in hypnosis that the biggest thing on that, which is important to have the mind in the right place, is that we say that the mind or the unconscious doesn't know the difference between imagined and real. They're
It
both
doesn't. No.
so they're both the same. So I say now at the most basic level, the idea of hypnotherapy is to get you to imagine stuff differently.
Yeah. Yeah. Because what you think is.
Yeah, yeah. So the
It's your perception, and that's
diff-
what it is.
Yeah.
So if somebody wanted to reach out to you, learn more about you, maybe there's a hypnotherapist that somebody turned this podcast onto and they want to learn about your courses, how can people reach out to you? And we will have all this in the show notes as always,
Yep.
but
Yep. Particularly for the oncology, and even for general hypnotherapy, people can get hold of me there. I've got a number of websites. The main one is hypno-oncology.com, which you can see in the background. That has about my mentoring, my appearances around the world, teaching, my online training and all that sort of stuff, and my books and so on. I do have another site called releasehypnotherapy.com, which is my general hypnotherapy. But again, people can get hold of me through either of them. But it's the oncology that most people know about. There are things on there, forms you can fill in to contact me on there. Or the other one is my private email, if it is my name with 2 R's, the important bit, but Garry Coles at hotmail.com will get to me as well.
love it. Uh, Thank you so much for coming on and giving the information about this. I think this I've never maybe I'm in the small majority or small population, but I had never really heard of this. I just knew I had done hypnosis, oh, probably 10 years ago or more to deal with a sports injury.
Right.
And I found it super helpful. And I've thought countless times, like, I should do this again. And then as we talked, I'm thinking, oh my God, for the sleep thing, this might be, I've dumped money into everything else that I'm still not getting quality sleep. I thought last night was the first night I actually slept well.
Yeah.
And then I look at my watch and it said, yeah, like a 56 sleep score. So it's still not quality. And I have that overactive brain, excessive neurotransmitters. I just don't like to shut off. And I just wonder, is that what's driving me? But I think it's just fascinating and for helping people with cancer because it can be so isolating and just having that hope that they can control some of what's happening here. I think it's very empowering to people that feel like they've lost their power through a disease like that.
Yeah.
So thank you for what you're doing. And I appreciate you coming on here and talking about this today. And I think your email might blow up at some point.
But yeah, I will keep monitoring it. As I said, I'm going to be on a plane in a few hours to teach in Denmark. As you say, my schedule is, man, I'm at Denmark in the morning, and then I come back. Then I'm in Florida, and then I'm in.
Yeah.
I'm coming across the pond a lot. I know I'm definitely going to be in Michigan, Vegas, and Chicago.
But Vegas in July.
Yeah.
Dear God, man, it's going to be blistering.
Well,
So,
it's actually the 8th year running I've presented in July in Vegas. So I know exactly what it's like.
oh, so you get it. You already
I
know.
keep getting invited back.
This place with a good pool, right? Indoor
Oh,
pool.
absolutely. Yeah, absolutely.
Safe travels to you with all of your travels all over the world. And again, totally appreciate what you're doing out there and keep fighting the fight because there's people that try to hold those of us back that are just trying to help people help themselves. And I think this is part of being your best medical advocate. Use every avenue out there to help you with healing or again with the immune system, build it. Build it up. Make things less hospitable. Your body is less hospitable for things to take hold. That's how I look at it. So, thank you so much.
Thank you.
Everybody, please share this with someone. Share this with someone who maybe just got a diagnosis or who's been dealing with cancer treatments or is just starting them or anybody that could potentially use Garry's help here. So, get out there, be your most authentic self, and make it a great day. Thank you for joining us. Thank you for tuning into my podcast. If you enjoyed this week's episode, I'd love for you to share it with someone who'd find the information useful. Please leave a review anywhere you listen to podcasts, and it'll help the information get out to others. If you're interested in seeing if we're a great fit to work together, the link is in the show notes below where you can sign up for a free consultation with me. So go make it a great day and let your authentic self shine.